Hi, this video is going to cover your postoperative recovery process after a shoulder arthroscopy. We'll cover everything from once you leave the operating room through the first couple weeks of your recovery phase. So right after surgery, we'll take you to what's called the PACU, which is the recovery room, where you'll be monitored until you're ready to go home. At the same time, your family member will be notified that surgery is finished, and Dr. Stampatakos will meet with them to review the surgical findings as well as to go over any additional instructions. While you're in recovery, you'll be working with the nurses and the anesthesia team, making sure that your pain is controlled and taking vitals, just making sure you're comfortable overall. They will also review the instructions for your regional anesthetic, which was the injection or a catheter that was placed in the neck at the time of surgery. They'll make sure that your sling is fitted properly, that the ice machine is intact and working well, and they'll give you our postoperative instructions as well. Once you're home, we recommend that you rest. A lot of patients will think that the arm doesn't hurt very much right after surgery and want to get up and do some additional activities, but we really encourage you to keep it quiet and rest for the day. Most patients find it helpful to prop themselves up on pillows or sleep in a recliner. Just find some place that's comfortable for you. Gradually increase your diet on that day. Don't eat anything heavy. Start your pain medication when you just start to feel some discomfort. Don't wait for the block to wear off, and don't wait for your pain to escalate. It's harder to catch up. And adequate pain control is very important for healing after surgery. Your ice machine should be used approximately 30 minutes on and 30 minutes off throughout the day as often as you can. Just make sure that the pad on the ice machine does not come into direct contact with the skin. Your dressings are going to appear fairly bulky. That's because there's a lot of gauze and pad underneath the ACE bandage and the ice machine that you'll see. We want you to realize that you're going to have some swelling, and over the next few days you might see some bruising that will extend sometimes down to the elbow, even into the forearm, and that's normal. Don't worry. We also want you to leave those dressings intact for 4 days. After 4 days, you can remove the ACE bandage and the gauze pads that are underneath the ACE, but leave the white steri strips in place. We encourage you to keep these completely dry for 2 weeks. For showering, you can place some saran wrap or cling wrap around the shoulder to protect those areas, but please try to keep them dry for the first 2 weeks when we see you back in your follow-up visit, and we'll remove your dressings for you. Exercises after surgery are also important. We give you a list of exercises and photos that depict these exercises, and we want you to do these at least 3 times a day, 3 sets of 10 each. If you have questions about those, we can review those, and we also will have a video later that will show you exactly how those are performed. It's okay to go for a light walk after surgery when you're starting to feel like it a few days later. Just be sure that your sling is snug around your body and there's not a lot of bounce. Sometimes it's nice to get outside. And be sure to call us if you have any other concerns or questions. Thank you.